Yoga isn't just a good way to relieve stress and get a good workout in. It can also help in lowering blood sugar levels as well as improving other diabetes risk factors. This video is going to cover 2 evidence-based yoga routines that have been shown to help with diabetes management. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can help prevent and slow the progression of diabetes. Yoga is a 5,000-year-old practice that originated in India as a way to provide balance and harmony to the body and strengthen the mind-body connection. Today, there's enough science to support the benefits that yoga provides in diabetes management, and in general, it's pretty safe and easy to learn. We have good evidence based on a meta-analysis that doing yoga on a regular basis can improve insulin levels, insulin sensitivity, and blood sugar levels. Specific asanas or poses that were recommended for these benefits were Tadasana or mountain pose, Trikonasana or triangle pose, Ardha Matsendrasana or half Lord of the Fishes pose, Pavana Muktasana or wind relieving pose, Paschimottanasana or seated forward bend, and Shavasana or corpse pose. Twisting poses may help improve digestion by putting pressure on the intestines, and forward bending poses are thought to put pressure on the pancreas and stimulate insulin production. Poses should be held between 30 to 60 seconds at first, but that duration can be increased the more that you do it. Pranayama or breathing exercises were also recommended and include Kapalabhati Kriya, which is more fast-paced and has been suggested to improve beta cell function in the pancreas by increasing abdominal pressure. Another recommended breathing exercise was Anulom Vilom Pranayama, which is more of a controlled breathing exercise, where you would alternate the nostrils. Breathing exercises can help to better regulate breathing patterns and heart rate. The last recommended technique was including an Om mantra meditation. Practicing meditation on a regular basis causes beneficial changes in the brain, and in people with diabetes, it can improve quality of life, lower blood pressure, and anxiety. Relaxation experienced through yoga, it may help with stress hormone management in the body. Stress causes increases in blood sugar as well as blood pressure, and yoga can help in reducing stress. This practice was recommended to be done 5 days a week, 45 to 60 minutes at a time, and I provided a link to this research study down in the description below. If you're finding this useful, please hit like and subscribe. Yoga has also been shown to improve blood lipid levels, which is the amount of fat that's in the blood, as well as quality of life. For triglycerides, cholesterol, and LDL cholesterol, a study by Gowrie and colleagues, they conducted a 4-month yoga intervention in people with type 2 diabetes. They did the yoga practice twice a week for 60 minutes at a time, and at the end of the 4 months, there was an improvement or a decrease in each of these blood lipids. The yoga protocol was a combination of different asanas, or poses once again, breathing techniques, and meditation. Standing poses like Talasana, or palm tree pose, Trikonasana, or triangle pose, Parsvakonasana, or extended side angle pose, and Virasana, or hero pose. Sitting poses included Pavana Muktasana, Navasana, or boat pose, Vakrasana, or half spinal twist pose, and Ardha Matsendrasana, or half Lord of the Fishes pose. An inverted pose, Viparita Karani, or topsy-turvy gesture, has been suggested to improve blood circulation. Breathing exercises like Chandra Nadi, which is a left side nostril breathing, and Kapalabhati, meditation chants and poses, and Shavasana were also included. The first time that I ever did yoga was about 20 years ago when I bought a book on different yoga poses. And even though I started learning from a book, I eventually started taking yoga classes, and receiving that feedback from the instructor, that was especially helpful in me improving my poses. More recently, I've found websites like doyogawithme.com especially helpful for whenever I'm wanting to receive instruction but not necessarily wanting to leave the house. Thank you for watching.